Pashka. I am thrilled and honored that PRA is taking part in their first series of Ignite sessions. But as you notice, they do go really quick, so without further ado, forget the bird, forget the bee, the three most important words for reducing risks for sexually transmitted infections. Now, at Boston University Center for Psych Rehab, I was a very green clinician. I hadn't even graduated yet. I was working with somebody around support education who was reading a memoir. And in the memoir, the character was raped from the time she was very young until she was older. And this is when I had my Ignite moment. Holy crap, because she turned to me and said, Nikki, why would somebody not want to be raped? And I started spewing out all these words, penis, vulva, penetration, and I just freaked out, and I left that session feeling awkward. Thankfully, I had great supervisors, and I started talking about when did we learn about sex? When do we teach people about sex? It's like when people learn to brush their teeth. You learn when you're 8, and then nobody follows up with you. My dentist yelled at me last year because apparently I've been brushing my teeth wrong. So what we need to do is we need to embed it into wellness. This is Sam says 8 dimensions of wellness. And I'm sure if we put our heads together, we could cram sexuality into every single solitary one of those. So that's what we need to do as programs, as agencies. We need to do better wellness work. We know a lot about sex education, but it's actually not very good. It focuses on intercourse, it promotes abstinence, it's heteronormative, you get it from school, maybe church or your family. I don't know about the internet, but it's pretty good. And then of course there's no continuing education for sex education, but we push safe sex and we throw condoms out at people and we tell people to take them, but we don't tell them to take lube, which is really important, and we push this really biased message about what safe sex is. Who is this safe sex for? Our rates of HIV in our population are 70 times higher than that of the general population. Hep C is 11 times higher. Diabetes, hypertension, lots of other comorbidities and wellness issues. We see tons of violence, discrimination, stigma. There is a general lack of focus and services, and it's because providers do not feel comfortable. We're not knowledgeable, we're afraid. And so we start pushing these fear tactics about sex is bad, intimacy is bad, relationships are bad, and we need to make a paradigm shift now. We did this in mental health, we're still trying to do it, but we moved from pathology to an era of recovery, empowerment, and hope, and we're hoping to do this with sexuality one day too. Now clinicians, we have our work cut out for us, but I wonder sometimes if we're helping or if we're hindering. Sometimes people feel they need to protect the people that they serve, but this just ends up backfiring on us, and we go back to that fear tactic of, well, maybe you shouldn't. So if you're uncomfortable thinking about it, here's an easy one to start with. Coach around consent. Teach people about boundaries, relationships, body cues, social cues, trust, trauma, saying no, hearing no, other outcomes. If you have other outcomes, you're probably going to interact with fluids. I was going to put up a petri dish of semen and blood, but I was advised against that. So I covered them up with little curtains for you. But think about which of these is the more dangerous fluid, okay? I've asked doctors this question and they get confused. Which of those is the more dangerous fluid? Because with sticky, creamy, and cloudy, it's pretty simple. If you interact with a fluid that is sticky, that's a pretty infectious fluid. Blood is ridiculously sticky. If you ever get a sinus infection, your big green boogers in there, sticky, infectious. Creamy, anything that resembles cream. Semen definitely resembles cream. Can't see through it. So this is an infectious fluid for sure. Cloudy, you can't see through it. Blood is cloudy, semen is cloudy, but tears, urine, sweat, these things you can see right through. These are good fluids. And I know you're all thinking about HIV, and it's not going to stop there. There are lots of other STIs that these fluids are involved with. So, and now a bunch of you are laughing, but the truth is if you can't talk about it, you probably shouldn't be doing it. And if you can't talk about it with your members or your students, you got to find somebody in your team or your program who can. Educate yourself. Go to as many trainings as you can. As clinicians and counselors, we have to be prepared to serve our members. We have to have regular, normative, consistent education that is a part of our wellness, period. It has to be integrated in, especially for young people. The World Health Organization has been on top of this for a very long time. PRA has been so gracious and welcoming of this topic. If you engage in healthy sex, it is going to be more pleasurable, I guarantee it. And we don't hear that word a lot in our community, so I'm hoping that we can do that more. Thank you so much to PRA, the Illinois chapter of PRA, Pennsylvania chapter, Thresholds, UIC, the Boston University Center for Psych Rehab, ICI, UMass, and all of you for being here.